Hi, welcome back to All Things Home Care with Dana Arnone. It's time for Ask Dana. Finding the right home care agency is one of the most important decisions that you'll make for you or your loved ones. Before you make these decisions, consider interviewing multiple agencies. Interviews are one of the best ways to get to know who you're hiring. You'll want a caregiver that is transparent, skilled, educated, and caring. To help make your decisions, consider asking the following questions as related to safety. What process do you use to hire and assess your caregivers? Most licensed agencies follow the similar Department of Health rules, which is when they come, they have to go through an onboarding process, which includes the application, reviewing their medicals, their titers. Now we're adding COVID vaccinations and boosters to the list. Also, we're running a fingerprint background check on them, as well as a drug screening. These are all important factors when you're hiring an individual to care for your loved one. If the agency that you're engaging does not follow the same thing, I would probably consider about not hiring them. What do you have additional screenings each year? Most agencies have the same screening process annually where they're going to reassess their workers, not only in the field, but they take a look at their physicals. They have to have an annual physical, a habituation statement. They have to have their annual PPD or quantiferin. They also have to have a drug screen, and they go through their in-services. That's on an annual basis. How often do you evaluate your caregivers? Every caregiver gets evaluated every 6 months by a registered nurse and upon hiring. Most of the times they'll be seen by the nurses regularly because every time if there's a caregiver that goes to a new patient and the patient is new to that caregiver, they are supervised to the care plan and reviewed as well. What training do you provide to your caregivers? Every agency has to have in-service guidelines for their workers. A home health aide needs 12 hours of in-service annually. Usually the first is their mandatories, which includes fire safety, OSHA, bloodborne pathogens, and things like that. And then the other 6 hours can be what the agency deems is important and things that are going on currently. It could be teaching them about diabetes, high blood pressure, congestive heart failure, anything that's timely to what's going on at that moment. A lot of times now everybody's talking about COVID and the vaccination process. PCAs, which are called personal care attendants, they're required to have at least 6 hours. Most of them fall under the mandatories. How do you respond to emergencies? Well, it always depends upon the type of emergency that we're referencing, but for the most part, if it is an emergency situation, we encourage everybody to dial 911. If there's something that we can handle internally in the office, I would say that the home care workers or the families should speak directly to their care coordinators or the nurse that's in charge that day or the director of patient services. May I have 2 to 3 references? That's a great question. All agencies upon hire, we are supposed to get 2 references for each worker. If the family would like to read the references or have access to the references, I think that's more than fair that they can ask for that information. Well, that's all the questions that we have for today. Please send any questions that you may have to info@allthingshomecare.org.